Did you know that 1 in 10 US Americans meet their credentials for a personality disorder? Now, that sounds like a lot of people, so why are we not talking about personality disorders more? As a perspective psychology major, I've taken several classes about psychology and I've had deep interest in personality disorders. Personality disorders, we're going to discuss what they are, different types of personality disorders that exist, and how we diagnose them to erase the stigma behind them and clarify some of those definitions that we might not understand fully. Now, when it comes to what exactly a personality disorder is, it causes people to act out of the norm of their society and really kind of make up their own rules in a sense and just kind of act in a way that we don't view as normal. The Gale Health and Wellness Association describes it as this: the one unifying feature of all personality disorders is the tendency for them to make people act in ways that are strange and outside the range of what is considered normal, healthy behavior. These people kind of make up their own rules, maybe just are seen as outsiders compared to the rest of us, but it's divided into three main sections, being cluster A, which is odd and eccentric behavior, and oftentimes shows up as distant, untrusting, and maybe delusional thinking. And then there's cluster B, which is dramatic and emotional, and these people are often manipulative, unstable, kind of rash in their emotions. And then cluster C is anxious and fearful, and it's oftentimes sadly misdiagnosed as anxiety because it looks so similar, but this is causing people to have misdiagnoses and not get the help that they need for their personal order. Now that we have a stable diagnosis of maybe what a personality disorder looks like, we can look at how they're diagnosed. And they're diagnosed through a book called the DSM-5. This book helps people diagnose all sorts of mental disorders, from anxiety and depression to personality disorders. So the DSM-5 describes itself as the primary purpose of the DSM-5 is to assist trained clinicians in the diagnosis of their patients' mental disorders as part of a case formulation assessment that leads to a fully formed treatment plan for each individual. The purpose of it is to really educate and guide people so that they can help make a solid decision about what someone is struggling with, and really helps them know what the next step should be for that person. Now, people with these issues are completely normal. I have a friend who has borderline personality disorder, which we'll discuss shortly, but she's completely normal. She has to take medication every day and go to therapy once a week to help her deal with these issues that she faces inside, but as a person, she can function completely normal in society. So borderline personality disorders are not something that we should be fearing and not something that we should be treating any different from a normal person. Now that we know kind of how they're diagnosed and what makes them unique, we can look at different types of personality disorders. So we're going to look at four main ones that kind of show up most commonly in our society. So the first one is borderline personality disorder. It causes people to be unstable in their relationships, have poor self-image, and it's oftentimes diagnosed as emptiness and anger and fluctuations of emotions, and can be interlocked with bipolar disorder. They're very similar, and borderline is often used to diagnose minors with bipolar. The next one is dependent, and these people crave to be taken care of by people around them and crave that feeling of secureness, and they hate disagreements because they think it'll turn people against them and they won't be willing to take care of them. And these people oftentimes sadly stay in abusive relationships because they fear that rejection that may come with that. And then this one's often correlated really closely with avoidant personality disorders because they both crave a relationship, but avoidant personality disorders oftentimes will be hatred towards themselves and maybe like have a poor self-image and hate the criticism that might come from other people because they feel like it's reflecting poorly on them. They hate new situations, they don't like socializing. It often causes them to pull back from relationships around them. And then OCPD is similar to OCD, but these people don't have intrusive thoughts that others might have. So this affects multiple aspects of their life, and that is the biggest thing that diagnoses a personality disorder, is that they have multiple aspects of their lives that are being affected. But now that we've seen different aspects of personality disorders, we can see there's nothing to fear with these and that they're completely normal. So I said at the beginning that 1 in 10 people have personality disorders. So do any of these traits that I've described maybe sound similar to someone you know?